Our reaction to this is that, COVID obviously has brought with it, a very mutant factor, and we have seen mutations. This is not new. We've seen several others before, and we have learned our lessons from them. And what we now know very categorically is that we should be science-led rather than just making knee-jerk reactions in as far as closing our borders is concerned. And what we have then done as a Ministry of Health is heightened our surveillance at the ports of entry and ensuring that any person coming into the country from those countries where this variant has been identified are properly screened. They must undergo or at least be able to show that they have done a PCR test, and we are even repeating PCR tests at the point of entry. We are also requiring that they must give us a certificate to show that they have been vaccinated. So we are not taking any chances at our borders. We are doing everything possible to ensure that that mutant does not, or that variation of COVID does not get into our territory. Having said that, we also recognize, of course, that passengers who have been coming in may have been slightly inconvenienced because, of course, we were all taken by surprise by what has happened, and we are working hard to ensure that the logistical issues happen very smoothly and seamlessly at our points of entry. But what is important to know is that we will first put the interest of securing the country first, even as we manage the borders. And so just to seek for patience as we increase the number of health workers at the points of entry who will undertake those vaccinations. But so far, we are happy that everything is well under control. We continue to appeal for people to get vaccinated because that is really the only protection that we have against this particular variant that has come and any other future variants that will be coming. The WHO has already indicated very, very clearly that COVID is still going to be with us way into 2022. But the good news that we keep saying is the vaccines we have are potent and they are able to respond against any variant so far. We have not seen any reports indicating of resistance of the current variant to the vaccine. So the only one guarantee that you have as a Kenyan to secure yourself is to get a vaccine. And to also just say that we have enough vaccines currently in the country and really to make a rallying call for Kenyans to go out and get the vaccine. We are not keen to see a lockdown. We are not keen to see any restrictions put in, and that can all be avoided if we each take our responsibility very seriously in as far as upholding the protocols is concerned. We are seeing people beginning to relax on masks. Please do not let your guard down. We must wear the mask, wash our hands, maintain social distancing, because what we are seeing is that COVID is still here. More importantly, take the vaccine so that you can prevent severe illness and prevent death. There is evidence that supports that very strongly. I would want to say very categorically that one of the things that is already in place at all our points of entry is the requirement for people to put in all their information in the traveler's application. And that is really for the purposes of tracing. So as we speak today, entering Kenya is not like entering any other country. In fact, when you go to some countries, nobody bothers you at the port. But in Kenya, you must be able to go into our website, load your data onto the traveler's form, and make sure that you receive a Q code back, which you must present at the point of entry. In fact, when you're boarding any flight into the Kenyan territory from anywhere in the world, they will tell you to make sure that you get that code, because otherwise you will not pass our points of entry. So that is already in place. As far as the other protocols are concerned, we are requiring, and we still have continued to require, that you must have a valid PCR test of at least 96 hours. So that is in place. We have also now started to ask that people must have vaccination certificates. And as I said, because this variant has only just come into play, The heightening is a process, and it has already started. In fact, if you saw what we had is a complaint of delayed, people being delayed to get into the country because they could not be tested. And really that demonstrates to you that we are serious and we are committed, and people must go through those protocols that have been set. It will be an inconvenience, but it is one that we must go through if we must secure the country, and of which we are determined to do.